Yat A. I'm Curtis Briscoe, the Program Director of the Navajo Nation Breast and Cervical Cancer Prevention Program. The Navajo language is an important part of the culture. We have bilingual staff out in the field. They're the key to this program.
Most of our healthcare providers come from different places and they're not native speakers. There's always a language barrier.
The first 6 months I was here, people just kind of watched me. Then when I realized that I cared about them, they put up with a lot. They put up with, poor pronunciation or the fact you don't speak their language well. But they know you're trying and they know you care.
Our staff are able to translate medical terms. For example, one of the things that's really difficult to translate is the word breast cancer.
Putting together two words, which is breast and cancer, it's almost like having to do a whole sentence structure. You're having to explain the cancer first and then the body organ or the body part. The old term that they were using in Navajo, in the Navajo language, was if you translate that into English, it's a sore that won't heal. So if it's not going to heal, that means death. We looked at more ways of trying to rephrase what it is we're actually trying to say.
We even have it broken down to where each section we have the English translation for it on our website that we posted up there for anybody who wants to take a look at how we specify breast cancer and cervical cancer and the English translation of each of the terms.
We have to be bilingual, Navajo speaking and English speaking, just to get across to our clients, especially the older population.
A lot of times it's about building a relationship with them. And a lot of them might live alone or live way off the road, and they want to interact with people. So you might drive several miles off the road to one house, then you want to go to the next house, you got to drive several more miles on the same dirt road, and then maybe turn off on another dirt road to reach that house. So it's very difficult distance-wise, not just for us to reach them, for them to reach services as well.
We have to almost promote our program and gain the trust of these women that are coming through our program for preventative screening.
Our mobile mammography effort is to make sure that we reach as many community clinics as possible here on Navajo.
We call it the boob bus here. And my patients actually love that. The boob bus is coming next month, and we need to get you on it.
Without that effort, without that infrastructure that we've created, then it would be very difficult for women to get screening services.
In the end, we're saving women's lives. We're saving them to be able to continue on with their families, to provide for their families.